everyone, so let's move towards our today's topic, which is first of all, the most important point is how will you tell the professor if someone asks you that what is mandible. So what will you tell them? So basically, mandible is a bone which will form the lower jaw, okay, and it is the only movable bone of the skull. Okay, in entire skull, the bone which can be moved is mandible bone. Okay, and this bone is the second bone for ossification. That means the first bone in our body which ossifies first is clavicle, and after clavicle the second bone is mandible. Okay, now mandible is formed by two half. Basically it consists of two half, right half and left half. Okay, and both half are meeting together anteriorly on the outer surface, and they are forming a line called as symphysis menti. Okay, and below symphysis menti on the outer surface there is an elevation called as mental protuberance. Okay, now first of all, before starting further, you have to remember that in mandible bone there are two surfaces, outer surface and inner surface. There are two borders, upper border, lower border, and there are two ramus. Okay, right ramus and left ramus. Okay, now on the outer surface, like I said, medial protuberance and symphysis menti is present. Now below the premolar teeth there is a foramen called as mental foramen, through which obviously mental nerve will pass, and below incisor teeth there is a fossa called as incisor fossa. Okay, there is a depression which is forming the fossa called as incisor fossa. Now we will talk about inner surface. The inner surface of mandible consists of a line, a prominent ridge or prominent sharp line called as mylohyoid line. Now, most important point, above the mylohyoid line, submandibular fossa is present. Now submandibular fossa is for submandibular gland. It's very simple. And below mylohyoid line there is a fossa called as sublingual fossa, that is for sublingual gland. Now we will talk about borders. Borders are very easy. Upper border, lower border. Upper border, when you will see the lower jaw, on the upper border you will easily see the sockets for teeth. So upper border consists of sockets for teeth, and lower border consists of medial protuberance, as well as you will also see a fossa called as digastric fossa. Now ramus are much more easier than any other ramus, because there are two ramus. Okay, and on each ramus on the upper end there are two processes. One is coronoid process and another is condyloid process. ठीक है. Now condyloid process is the posterior process. Okay, होता ये है कि when you will see the diagram or when you will see the mandible, the anterior fossa, the ramus, the process of the anterior process is the coronoid process, and it is basically shorter, as well as it is present on the anterior side. So that process is called as anterior process, whereas the posterior process is longer process, as well as it is present on the posterior side. So that process is called as condyloid process. Now the topic for mandible is completed now. Now good luck, study hard, work hard, and good luck. Bye, take care, thank you, bye.